Yeah, hi, I'm Lisa Brophy. I'm Professor of Social Work and Social Policy at LaTrobe Uni, but I'm also still at the University of Melbourne, where I'm funded by Mind Australia to be their Principal Research Fellow. So I do lots of mental health research and supporting social work education and research as well.
Now, we've just been at a smoking workshop.
Yeah.
What's your takeaway?
Oh, look, it was really great to be there. I was actually presenting with Nadine Cox, who's from Mind Australia, who's a peer worker and now peer researcher. We've done some projects together before, and we really got so much support for the idea of peer workers being more involved in efforts to support people in relation to smoking cessation. And really that was coming from the idea that we've got very marginalised populations of people who are engaged with smoking and smoke a lot, and we need to really try and understand what's stopping those people from being able to access what we call these evidence-based interventions. And one of them is Quitline, where people get telephone support, and then there's NRT, which has also got great evidence, that's nicotine replacement therapy. But it seems like that there's still groups of people who are left out of all of this. And peer workers might be a really great way to try and engage people more with evidence. We've already got lots of good evidence that peer workers are fantastic at engaging people, so maybe that's going to be important. But I think one of my messages that I tried to kind of put forward was that we've really got a social justice issue on our hands, and we've got sort of social and structural factors that are getting played out as much as sort of health concerns. Like why are marginalised groups so highly represented in the people who continue to smoke? What's going on for people? And what could we do to reach out to those people to be engaged in more co-production about what we can do to help people to move forward in terms of quitting smoking.
Do you have some thoughts about how that would look?
Well, I think it is about the kind of messages. I think, the stigma and discrimination that sits around people may be really important to engage with, and I don't know, like at an individual level that might translate to sort of the hopelessness that people might feel, the lack of support they get from other people, about something I was saying about the importance of people feeling that they deserve those extra life years that giving up smoking might offer. And I wonder to a certain extent how much stigma and discrimination plays out in people's identity and and the people around them, and how much support they're getting. But then I think we also have to think about the other big factors, which is about the costs of NRT. I was raising that. I think people actually, when we started to really talk about the costs of NRT, actually it's a lot. And is it an alternative? Is it a realistic alternative to smoking? And especially if it's risky for someone to actually invest in something they don't know whether it's going to work or not. So I was so pleased to hear in Queensland that NRT is free for the groups that we're talking about. That's just a great step forward. But we need to be able to do that more consistently. And even the government only enabling people to get free NRT for 3 months rather than 12. Well, again, that's a real problem. It could be a very important social justice issue for people to be picking up with and advocating around.
Fantastic. Thank you very much, Lisa. I'm so sorry we've got to go to the next session.
Okay, thanks.